Good morning, everybody. Welcome back. I hope you all had a great weekend to recharge so we can continue to provide those life-changing adjustments for every single family that walks through our doors. This week's education is going to be about women's health and how the chiropractic adjustment plays a vital role in allowing the body to better adapt to all the physiological milestones a woman goes through. Now let's get started. Today's condition, we're going to be discussing adolescent idiopathic scoliosis. First off, what is scoliosis? Scoliosis is when we have abnormal curves within the spine. And as we know, the purpose of the spine is to protect the integrity of the nervous system, so that way the nervous system can communicate with the brain and the rest of the body. If there are any sort of abnormalities or dysfunctions within the spine, we know that the nervous system's ability to communicate is then affected. Adolescent idiopathic scoliosis is 8 times more common in young females than males, and it is often diagnosed between the ages of 10 and 18 years old. If this type of scoliosis progresses, it can progress so extensively that it impacts the function of heart, lungs, bowel, and bladder. There are many great chiropractic and scoliosis success stories out there, and I'm going to be sharing one with you today. There is a study that was published in the Alternative Medicine Journal in 2008, and I'm going to be reading verbatim to you what happened with this young female. A young 15-year-old girl had been suffering from AIS for several years. She underwent the appropriate PT and bracing protocols for 4 years, and still that right thoracic curvature continued to progress at an alarming rate. This patient then decided to undergo spinal manipulation 2 times a week for 6 weeks, and then gradually reduce frequency over 18 months. After the 18-month period, they did a follow-up series of radiographs and examinations, and they were able to see that the Cobb angle reduced by nearly 35%, which is amazing. Meanwhile, the patient's lower backache had eased and proper function of defecation frequency had been restored, and this was an issue for that patient. This study suggests that in at least some severe and progressive cases of scoliosis, chiropractic treatment, including spinal manipulation, may decrease the need for surgery. And guys, there you have it. Another amazing story where the chiropractic adjustment was able to prevent somebody from undergoing that invasive surgical route. Let's get out there today and talk about how impactful our adjustments are for our young females, even for those who are not suffering from AIS. And I'll be seeing you guys again tomorrow.